I'm Bill Bogard, the mayor of Pasadena, and I'm down at Brookside Park near Pasadena's world-famous Rose Bowl, learning about a very important event that's taking place. It is the American Heart Association's Saving Strokes program.
The Saving Strokes program started in Sacramento. We've gone from 5 sites to 15 sites. This is our second year in LA County. We're really excited, obviously, to be partnered with Huntington for this year and next year.
Essentially, the goal for the event is to, we invite any stroke survivor in the community, in and around Pasadena, to come and just have a fun day where they can, after an initial assessment, they will have a private one-on-one golf lesson with one of the golf pros here at Brookside.
I felt vibration. I shouldn't feel.
That's. I'm glad that you're picking up on the on that.
The grip is more towards your belt buckle. Okay, does that make sense?
Whoa. Good job, man.
The survivor does not have to be a golf player. They can never have played golf before, or they can have had golf. But the idea behind the program is just to really get them out and about and let them know that they can feel comfortable to still do some activities that are fun.
Partners like Huntington Hospital make this possible with not only financial sponsorship but also volunteers and just having a presence on the day of event there. It really positions them as such a major partner in stroke in the community of Pasadena, but also in greater LA County. So we're really excited.
So I'm proud that Pasadena ties with the Huntington Hospital in its commitment to healthy living, a nutritious style of life, and a long and enjoyable quality of life for all the people of our city.
Hi, I'm Andrew Imbus.
I am Debbie T. I'm a nurse practitioner and stroke coordinator, and Andrew and I work together at Huntington Hospital. I think this event in itself is very rewarding because we see a lot of our stroke patients that initially came through us that couldn't move, didn't look like they're doing well, but seeing them out here today, it's very heartwarming, and what we do makes a difference in people's lives, so that's very important to us.
There you go. Much better.
What Debbie and I do is try to make sure that every patient that comes to Huntington Hospital gets every service that's available. Should it be the clot-busting TPA medication? Should it be an intervention such as surgery? Should it be simply medicinal therapy? Whatever the services are available to them, not only do they start, but they're able to go through the entire continuum at Huntington.
So you did okay out there, huh?
Thanks to Dr. Ohanian and his wonderful team. I'm here today about 95% as good as or better than I was before the event. It was a major stroke, and I think immediately after I was probably 50% at best. So it was a progressive return from there, but again, with Dr. Ohanian's guidance and another team, a related team of professionals and nurses and technicians, lots of help, lots of guidance, and lots of self-discipline. Psychologically, it was a struggle because you have to cross over between saying, I'm positive, I'm dedicated, I know what I want to do, but, you know, creeping in the memory is, I've just had a major stroke. I could have easily passed away. And so there is the psychological challenge as well as the physical challenge. And I think on a given day, one could displace the other is more challenging. But I think when you dedicate yourself to an end result, they kind of come together and say, I'm going to get there.
Seeing the patient just when they come in at a particular level and the families are there and everybody's just, they don't understand quite what happens. They see what happens on TV and they see the progression of their loved one from being not able to speak to being able to form words, to being able to recognize people and to be able to function as individuals. That's most rewarding because it's emotional because they want to, that's a big it's a lifestyle change in itself, and it's just big for them to be able to be a part of what they once were. They may not be 100%, they may not be 50%, but at least they're part of what they were.
We have a stroke support group which meets the second Tuesday of every month, and they're a great bunch of people, really super bunch of people. They're real heroes. They've been through stroke, but they've really overcome as best they can. The amazing thing is sometimes you'll see them as they first come into the hospital, you know, and they're quite debilitated, and you counsel them and you help them through, and then, you know, they go up to the rehab unit and you work with them up there, and the next thing you know, they're part of the stroke group, and you see little by little them getting better and better and better and more functional, you know.
I just wanted to kind of catch you up on what we're doing on our end. We're trying to develop Huntington into, and we think we already are at that point, of a comprehensive stroke center. There aren't many hospitals that are able to do a lot of these therapies, and we think we have a real unique opportunity here in Pasadena. I wanted to thank the American Heart Association for actually putting this together and having the foresight to do so. And specifically, I wanted to thank Huntington Hospital for really making us proud and sponsoring this event, and also for those of you who do not know, we'll be doing this as well next year as well. So another opportunity to get out, and for those people who weren't able to make it either because of the weather or just didn't hear about it, hopefully next year we can have a even bigger turnout.